All right, trying again. I have the great pleasure of introducing Dana March Palmer, who is a former colleague of mine from Columbia University. Dana is the Senior Associate Provost for Academic Programs, a faculty member in epidemiology, and Director of Undergraduate Studies in Public Health at Columbia University. She has spent her academic career at Columbia, where she earned her MPH and PhD with distinction. In her various roles, she has managed the MPH core curriculum, doctoral education, and the undergraduate special program in public health, which she directs and in which she teaches two popular core courses. Deanna also currently oversees academic programs and accreditation at the university. So, she's a little busy. Dana is a decorated leader in pedagogical innovation in public health education and has long served as the co-director of the Biostatistics and Epidemiology Summer Training Program and diversity undergraduate diversity. Her research and mentorship have focused on mental and physical health, social inequities, public health education, and communication about public health science. Dana, over to you.
Thank you so much. Well, thank you so much. It's really just such a privilege and a pleasure to be here with you. This is such a beautiful open campus. I had the pleasure of walking around a bit yesterday, several times after having a little bit of barbecue at across the way there. And so um, I'm here with you today because I am deeply interested in and intrigued by what you all are doing in public health and blending arts and sciences in public health and the extraordinary undertaking of starting a new school of public health. So I am going to talk to you about what I see as the imprimatur for standard setting undergraduate education in public health. I'm going to address, there's kind of two or three parts to this talk, the here and now, then the why and how. You should understand in my talk, first, what my perspectives are regarding the need for and possibilities in undergraduate public health education. And second, my teaching philosophy and values refracted through the lens of some key examples from my programmatic and pedagogical work. Then I'll open it up for questions and hopefully discussion. Does that sound like a reasonable plan to you? Okay. So nationally, it's a time of great political division, a time in which the meaning and function of American democracy and the boundaries of the Constitution are being tested. Globally, key conflicts and partisan politics and efforts to consolidate power both inform and are in conversation with the moment of reckoning and potential reformulation in United States history. And at the heart of this divide is the role that the federal government plays in providing services and support for populations within its borders and beyond. Commitments to countries with fewer resources than the United States are being renegotiated and, in some cases, discontinued altogether. Who belongs and has rights within US borders is also at stake. But it's been a long time coming. If we look through the lens of party polarization, for example, in the House of Representatives, and here this graph shows you that polarization over time between 1949 and 2011, we can see clearly this evolution. And there are two things that you can see here. One is the fluctuation in the balance of power, and most importantly, the diminution of participation across party lines, reflecting the entrenchment of political agendas. And this has some key implications for public health and society. The United States is a founding member of the World Health Organization since 1948, on the heels of World War II, and it intends to withdraw its membership, according to an executive order issued on Inauguration Day by our current president. This vital organization plays a key role in protecting the health and security of global populations and relied on the US for 16% of its revenue in 2022-2023. With the US, the WHO has ended smallpox, brought polio to the brink of eradication, helped to control neglected tropical diseases, reined in malaria, and has been pivotal in HIV/AIDS treatment and prevention, among other deeply important public health activities prior to COVID-19. And in the ensuing days of the administration, USAID has effectively been dismantled, hobbling global public health and the work that it has in the world with tangible impact. And domestically, the workforces of the CDC and the NIH have been cut by about 10%. Together with the termination of billions of dollars in research and infrastructure funding to American universities, the suspension of grant reviews at these engines of public health research, should they stick, and that's a question, have the potential to put a significant governor on the critical production of public health knowledge and ultimately impact. The return on this disinvestment is no doubt the loss of lives. To wager more in a public health gamble, other key government agencies have suffered paralyzing cuts, potentially affecting the prevention of infectious disease and pandemic preparedness, the safety of our food supply, the integrity of our environment, the ability to recover from federally declared emergencies and disasters, our safe passage, and the physical and mental health of veterans. And finally, like USAID, the Department of Education is the target for undoing, serving to amplify further inequities in health across multiple generations of people in the US, and an incredibly large body of literature, both directly and indirectly, shows that education plays a key role in shaping health and well-being. Moreover, some of the very populations, here we go. Moreover, some of the very populations for whom both the possibility of and inequity in American life has shaped dimensions of their health are subject to rights restrictions and even expulsion from the country, some for their beliefs and expression thereof. And recently, Colombia has been the site of such activity, although not because of the complicity of the leadership and administration. But if we conceive of this graph here of the ICE deportations updated on March 9th as an epidemic curve over the course of the next 4 years, we may well have a forthcoming peak in these deportations that exceeds the observed peak in the summer and fall of 2019, only this time much higher. This just might be a continuous source epidemic. And locally, in the last 2 months, protesters at WashU in St. Louis have organized and stood up for science. Advocacy groups in St. Louis have protested deportations and policy changes they see as discriminatory to immigrants, women, and veterans. Chancellor Martin co-authored an opinion piece for the Chronicle of Higher Education calling for universities to return to their core principles of academic excellence, academic freedom and freedom of expression, and accessibility. And finally, I know you all have been dealing with a lot of storms here very recently. And even though thousands in the St. Louis area have been without electricity, clearly you all are not without power. Your voice is clear. Opportunities for growth and innovation are almost always partners of uncertainty, however clear they may or may not be. The ideas, imagination, resources, and action required to avail ourselves of one such opportunity for public health education clearly are here at WashU. The outstanding groundwork you all have laid over time is intentional, robust, and mission centric. And I really look forward to a deep dive in person today. Delightfully, get to meet with faculty, students, and staff. But I'd like to explore with you more what this moment demands programmatically and pedagogically to grow and evolve a truly special undergraduate liberal arts program in public health and society here at WashU. And my street cred is that I've spent the last 12 years developing, teaching in, and leading one such undergraduate program at Columbia, among other educational research and leadership activities. So now let's get to the why. So we're at a time where there's a confluence of compromised public trust in science, shifting ideas about what constitutes evidence, echo chambers on social media that give rise to viral content and misinformation across the political spectrum, and importantly, artificial intelligence. Creating and maintaining population health for all in this context demands interdisciplinary collaboration, rigorous thought, and the formulation of effective, if flexible, strategies. Successfully creating and maintaining population health for all locates us squarely in the middle, It's what I like to think of as being in the deep purple. Now, the how. A unique opportunity resides in liberal arts undergraduate education precisely because of ideological polarization. The bedrock of liberal arts public health education, both rightfully fostered and sheltered by our universities, is academic freedom, intellectual curiosity, critical thinking, reasoned argument, communication, both written and oral, and civil discourse and debate. And were our views homogeneous, how could this bedrock possibly be the substrate of intellectual growth? In some ways, what ideological polarization offers is really a shorter, more scenic walk between ideas and imagination and action. At the extremes, opposing viewpoints are crisp. That is, in fact, the joy of the binary. For example, a priority of a reduced role of federal government sharpens the calculus of cuts. But does this benefit population health for all? I would argue, in fact, that cuts do not have population health or health in all policies at their very core principles. But in order to navigate these cuts, we have to come together across party lines using the skills and the education and the interdisciplinary collaboration that we have. And that is the way forward. So now what I'm going to turn to is what we've done at Columbia programmatically in terms of building a liberal arts public health education and animate my teaching philosophy and values through some examples from 2 or 3 key courses that I teach. So the goal of our special program in public health, and I have to give you a little bit of context with this. Uh, Departments have majors. We just recently introduced minors. Historically, minors were not a thing. We had majors and we had concentrations, and they're located in departments. There is no department, kind of like here, there is no department of public health in arts and sciences at Columbia. But what we wanted to do, and this started before as when I was a doctoral student, what we wanted to do is locate ourselves within arts and sciences and create a program that would afford the opportunity for undergraduates to study public health through a liberal arts lens. And there was some real kind of hinkiness around that because they were worried, in fact, that this would be pre-professional education, and we wanted to kind of keep away from that with a 10-foot pole. But what we conceived of and negotiated with, and this began with our current dean, Linda Freed, who is set to retire this summer, a negotiation with the then dean of Columbia College, Jim Valentini, and said, okay, we're going to launch a couple of courses, and then we're going to build it and see how it goes. But the overarching goal of this program, as I ultimately took over, developed, and crystallized, is to educate a global citizenry about the interplay of public health and civil society. The idea with a special program, which is a designation that's given to professional schools at Columbia, and there are 3 such special programs in arts and sciences, is that this would be akin to a minor, a secondary credential that folks could pursue. And our rationale was very crisp. Our world is increasingly connected, global, urban, aging, and inequitable. And we've got a whole series of existing complex problems and emerging complex problems that really demand nimbleness and flexibility in the application of public health knowledge and being able to leverage the foundations of liberal arts and what it offers to achieve solutions that we're trying to craft. And critically, this is such a key component of this program. How population health is understood and promoted is replete with controversies and tensions that are so ripe for intellectual interrogation. So, public health, there's no greater controversies that exist in other spaces than in public health. It kind of captures it all. So, what the special program comprises is a core group of courses at 16 credits. There's one course that's 4 credits. And I'll show you a little bit about the timeline and how we rolled this out. But this is modular in nature. We've got an introduction to public health, foundations of global health, the social history of American public health, environmental health and justice, and a course called Your Longer Life. And I'll get to that one in a moment. And then students are, after they take these core courses that are modular in nature, they can take them in no particular order. They take 3 electives from arts and sciences. And the idea is that they have the ability to have breadth. So if they're interested, for example, in population health and urban planning, if they want to touch on the environment, if they'd like to explore further some dimensions of history that are relevant to population health, they can do that. They can also do a deeper dive and kind of focus in a particular emphasis area, let's say urban planning, that they're interested in pursuing and getting greater depth in. So it's designed necessarily, I think, not unlike kind of what you all are trying to do, to give students some flexibility and agency in terms of their own intellectual pursuits. I'll give you a little kind of background in terms of how this rolled out. We launched these first courses in 2010, the social history and fundamentals of global health. And the idea is that we would assess, kind of take stock of what students were enjoying, what they liked about these courses, what they wish were different about these courses. And the basic consensus is like, yeah, there are good courses, there's substantial interest, we've got, substantial enrollments in these courses. And then in 2014, we launched the Introduction to Public Health, which was a course that I ironically co-developed with Sandro Galea. And we taught that first offering in spring of 2014 together. Had the same thing. This is substantial interest, good course, but really like what we found over the years, and then he dropped out after that first year. He was like, "You got this, go ahead." What we found, in fact, because that initial offering was guest lecturers who had, topical areas of expertise. And so it was kind of series of guest lectures that were trying to kind of paint a picture and, give this broad sweeping view of what public health actually is. But what we found, in fact, over time is that students really they liked the guest lecture part of it, but what they were really interested in was having a professor to guide them through a curriculum. So having somebody to stitch everything together and maybe more, kind of singular instructor involvement over time. So that was really good information. So we finally got together this special concentration that, appeased the desires and pre-professional kind of fears of the liberal arts committees on instruction for Columbia College and the School of General Studies. We launched that special concentration, and then we launched the final 2 courses in that set of core requirements. So Your Longer Life, which is a course that I co-developed with Dean Linda Freed, and Environmental Health and Justice. And the idea behind these 2 courses is that they would be team taught, not necessarily, which y'all have a really unique, situation where you're blending folks from arts and sciences and folks from public health to team teach. That's truly innovative and interesting. This, I'm afraid, was just all people from public health, but still a really interesting model. And then in 2020, we had the first graduates of that program. And, we're continuing to assess, what's going on with these courses. Let's talk about the program. We had some focus groups and so forth. And really the resounding message from folks was, okay, this is great. You have a special concentration. It was called special concentration at the time. You have a special concentration. When are we going to have a major? And, the structures of academia are sometimes a bit rigid, as you well know. So that's really kind of in some ways a non-starter at Columbia. There's not much appetite to do that because of these very rigid structures. Nonetheless, this is a very popular program. And on the heels of that, we launched a 4+1 with Columbia College and the School of General Studies. And I'll just give you a little bit of context about that as well. So Columbia College, there are 3 undergraduate schools at Columbia. There's Columbia College, the School of General Studies, which is really for non-traditional students. It was started, post World War II to really provide a home for GIs to come and pursue an undergraduate education. And it is a place where artists and actors and people who have had these really non-traditional paths in life come and get a degree. They're fully integrated into the Columbia community. My husband is an alum of this program, so at the age of 59, graduated from the School of General Studies. But they're mixed in with folks who are 18 and taking all the same classes. And then there's also the School of Engineering. So this special program is available to Columbia College students and to folks from the School of General Studies. Now I'll give you a little bit of data on our program. So our courses are large. These core courses are very large. 124 is the average enrollment. And this also includes Barnard students. So we have a connection with Barnard. They're able to, take any classes at the university, at Columbia College and so forth. And we've got kind of an oversubscription in many ways of Barnard students, particularly for the introduction to public health, because they can use that to meet a requirement that they have, kind of a modular requirement that they have at Barnard. Pretty highly rated on a scale of 5. We're doing okay in terms of our average instructor rating effectiveness, and it looks very similar for the overall course evaluations. We've had 111 graduates to date, the bulk of them coming from Columbia College. And that's across 19 different majors in the special program. So one of the things that we kind of thought going into this is that we would be really kind of a magnet for pre-med students. That we would have an oversubscription in many ways from that particular population. And we have been so pleasantly surprised by over time just how increasingly diverse in terms of people's major areas of study are in terms of their pursuit of this particular credential. We did just get a Rhodes Scholar who had the special program as a secondary credential, and we're very proud of her. And kind of the career paths that people take, post-grad, they go into law, they go into public health, medicine, other kind of arts and sciences, grad school, health adjacent, work in public health adjacent fields, and consulting. That's a big pathway for Columbia students. And increasingly, we're having more and more economics majors. They tend to go into investment banking. But the idea behind this is really that, and in particular, a course that I'm going to talk to you about in a moment, is that wherever they go in life, whatever path they pursue, because this is a secondary credential, that they're going to understand that there's public health infused in all spaces of the world. Even if you go into investment banking, indeed, public health resides there. And that's the idea and the ethos. And that really is kind of the force of this special program. Okay. What are our plans for this? We do not have, and I don't know if things kind of work the same way at WashU. Like, there's a lot of kind of gentlemen's agreements, informal agreements that you have among schools at Columbia, and we are needing to formalize that agreement. This was kind of folks going out to dinner and saying, "Hey, this is okay to do this," and they gave us the resources to do it. But particularly in a moment where there's a constraint on resources, it's really necessary to formalize that agreement and make sure that this program can, in fact, be sustained. I don't consider it to be imperiled in any way, but it would just be nice to have that in writing. I'm also interested in creating a formal agreement with Barnard for exclusive sections for their students. Because in fact, in my introduction to public health class, which the last offering was 234 students, it was over half of the students were Barnard students. So they don't actually have the option to pursue this special program in public health. And so there might be a need to kind of reconfigure and rethink how we serve the Barnard students and then separately the Columbia College and General Studies students. I also think that this is a time, for example, that we need to re-examine our curriculum and put our heads together As you know, there's syllabus creep over time, absolutely guilty. I should probably connect with the Committee on Instruction and just check in if what I'm teaching is still kosher. But I think we need to look at that from a curricular perspective and to look at what synergies exist and also where maybe what we're covering is not as relevant or crisp or sharply applicable to the moment as we might want it to be. And then also, I mean, one of the, I think the advantages, but a place where we really need to shore things up is strengthening the recruitment to the MPH program and the MS degrees at the School of Public Health. We do have people that come over for sure. And in a variety of pathways, right? People who pursue the 2-year MPH who go for, let's say, an MS in biostatistics, people who pursue the 4+1 program. We also have a 4+1 agreement with Barnard. But I think we could be much more intentional and much more efficient at recruiting our students into graduate study in the School of Public Health. But I do think that there's also a need, and I think the 4+1 provides a pathway to that, but to kind of sweeten the deal in many respects. Okay, so now I'm going to pivot, giving you kind of an overview of what the program is. So I want to get into how I approach teaching, what my philosophy and values are in teaching. So I've separated these into kind of two buckets: my philosophy in terms of teaching and what I think is really important in terms of learning. So, first and foremost, we are all human. I am a big proponent of empathy in teaching. And that means flexibility. That means meeting people where they are. Because, look, life is really complicated. It's growing ever more complicated. But I am interested in engaging both populations of learners and individual learners. And that feeds into an ethos of inclusion, community, and connection. It's deeply important to me. I also think instructional differentiation is important. People learn in all kinds of different ways, and to be able to meet them where they are in terms of their own learning while moving the class forward in terms of your intellectual goals is critically important. And finally, authentic assessment. Assessment that applies what people learn, not just forces them to memorize and then regurgitate information. Public health is the perfect place for authentic assessment because you can take these principles, you can take these skills, and you can bring them together in an interesting, compelling, and synthetic way and assess their learning and understanding and ability to apply beyond. Now, learning. It's important to be actively engaged. It's important to have intellectual agency, to have some control over your learning. It's important to get feedback and to reflect on what you've learned. And most importantly, I think, because it feeds into everything else, it's actually important to have fun in what you're learning. Learning is serious business, but it should be fun. Okay, now, to animate this, I'm going to first take the introduction to public health, then I'm going to talk about year longer life, and then if there's time, I'm aware of time, I'll talk about what work I've done at the MPH level with an integrated biostats and epidemiology course. So this introduction to public health course, I told you a little bit, started in 2014, had one particular model that was kind of a survey model, and it's evolved over time to be really a course that uses a particular lens. I always tell students, this is public health refracted through my particular lens, right? So it's maybe non-traditional in certain ways. I'm interested in teaching these foundational principles of public health. So taking ethical issues, paternalism, what it means to have a robust evidence base for public health, various controversies that we can mine to explore, just really contoured issues in population health, but through this lens of taking large, complex public health problems at the nation's level, at the city's level, and at the neighborhood's level. So this has grown dramatically over time, about 8 times over time. And as you can imagine, there are some issues with scaling this kind of course. So some of this evolution represents kind of the demands of scale. But I'll give you a table, and there's a lot in this table, but it really is intended to kind of lay out what our assessments are, and I'll give you kind of a window into the substance of the course through these assessments, but what their purpose serves, and then how that really maps on to my teaching and learning foundational principles. So I do typically in a class of, it seemed kind of maybe strange to poll you as is a relatively small group here, but in a class of 234, I need to take the temperature, right? Because I don't know if Mary over here is shopping for shoes or taking notes on like what we're trying to talk about in class, right? I do say I wear a size 8.5, like if you want to buy something for me. But it's taking in a poll to just get people engaged. Not everybody in a class of 234 is going to raise their hand and try to contribute to the discussion. And honestly, in 75 minutes for a lecture, if 234 people raise their hands, that might be a bit of trouble, right? So that really gets us to real-time assessment and allows me to take the temperature in terms of understand with whether or not what I'm saying is landing. Um, there are unique writing assignments, both at the nations and cities levels, and these are called module analyses. And these are 2,000-word papers that ask students to pick a significant public health problem of their choosing, to describe that public health problem, to describe the current solutions being deployed to that public health problem, and to critically analyze those solutions and offer a way forward, right? So it requires them to do quite a bit of research. And also, I encourage the use of AI as a tool for research, but I am quite clear that I am disinterested in generative AI because that robs people of intellectual growth. Um, so there's also, we do this at the nation's level, we do this at the city's level. Again, this is a different type of agency. Let's say a student is interested in addressing the opioid epidemic, which is a problem that I cover in class. They may choose to write about that at the nation's level and at the city's level, right? We're forcing them to think about this problem through the lens of a level of organization. Or they can do completely disparate topics. They can address the opioid crisis in the nation's, module analysis, or they can take a completely different topic at the city's level. So they have that, and this presents some unique challenges with respect to like grading and evaluation and so forth. It requires real engagement on the part of our teaching team. And then finally, kind of the pièce de résistance of this course is a neighborhood tour project. Now, they don't do any other kind of writing at the neighborhoods level, but we live in New York City. It is honestly a public health laboratory in real life. We have a very robust Department of Health and Mental Hygiene. They publish data they publish community profiles regularly. So what I have the students do is, and this really is kind of the last 6 weeks of the course is deeply focused on this application project. They go in and they look at the data. We do this in-class work, and they find two neighborhoods in New York City, and it can be across the 5 boroughs, that are either different or disparate on a given health outcome. And their charge is to design an intentional tour of both of those neighborhoods and try and understand the neighborhood conditions that may have given rise to the particular pattern of that health outcome. And students love this project, and it's very, very intense. I've toyed with group sizes from 6 down to 2 this last offering. I think about 4 is probably the sweet spot. But they love this project, and it really does force them to engage these kind of fundamental principles, the Jeffrey Rose principles of sick individuals and sick populations, fundamental causes, trying to understand how inequities are baked in or advantage is baked into the local context in which people live. So just this is kind of a sweep. I wanted to give you kind of an example. This was an outstanding project. This is not at all the total project. What they end up doing is putting together a slide deck And we have final reflection groups. So in lieu of a final, we spend about 3 hours. We intentionally put groups together, let's say 3 small groups together, and they spend that time that we've allotted for the final discussing and reflecting on this project and looking at commonalities, looking at differences. All kinds of issues come up, issues around white saviorism. I mean, the discussions are completely rich and contoured. But this particular project looked at maternal health between Morningside and Hamilton Heights and the Upper East Side. And there's kind of an interesting the inspiration for this project was really this idea that you can take a train, the 6 train, one express stop from the Upper East Side to East Harlem, and you've got a difference in life expectancy of 6 to 7 years. You've got radically different health outcomes, better mental health outcomes in East Harlem, worse physical health outcomes in East Harlem. Those neighborhoods could not be more different. But these students have gone all over the 5 boroughs, to Staten Island, to the Bronx, to Queens, to deepest of Brooklyn, looking at these differences and how the local context contributes to these differences or disparities in health. So, how is this assessed? Uh, Teaching assessments, I enjoy the quantitative assessments. The qualitative assessments are particularly helpful. I have to point out that, so this is one such qualitative assessment. And beneath that particular assessment, beneath this statement in my teaching evaluations from fall of 2024 is, she is too verbose. Both of these things are true. I love to teach, but I also talk too much. Okay, so some of the challenges with this course are, how do we preserve intimacy and connection at scale? And that's kind of where the smaller group projects come into play. It's really critical to have that balance, and that's kind of an ongoing negotiation. So when you're thinking about scaling up these courses, having that balance of engagement and that ability to connect while also kind of serving a population is really key. One of the challenges with giving students intellectual agency and choice in terms of the topics they pursue and so forth is that sometimes they can find a disconnect between what we're actually covering in lecture and then what they ultimately write about in terms of their module analyses or what they might do in the course of their group project. And then some of the more kind of benign but important, resource related issues, like how do you get a classroom, where desks that seats 250 people, where it's not just designed for like white men to like lecture at people, where the desks are like bolted to the floor and so forth. And then large teaching teams and so forth. I take pretty seriously the charge to mentor my TAs and give them some pedagogical foundation in what we do. Okay, so I'm just gonna talk about one more course, and if you're interested in what we did with quantitative foundations, the Epi and Biostats course, I can talk to you about that later. Your Longer Life is this really interesting course that, at least I think so, that was developed in collaboration with Dean Linda Fried, and she is one of the world's leading experts in aging. And this is really an exploration of both the opportunities and challenges that we have with an aging population, right? Public health is largely responsible for adding 30 years to human life. But okay, what do we do now? We've got societies that are ill-equipped to handle that. We've got a public health system that's ill-equipped to handle that. But interestingly enough, we like to think of older adults as the world's only increasing natural resource. And the idea is that we'd like to extend health span, as in accordance with the lifespan extension, to create this third demographic dividend, whereby older adults can be fully leveraged to better society with all of the skills and experience and the generativity that they have as a population. This particular class brings together undergraduate and graduate students. It's mostly undergrads. But interestingly, we have an intergenerational classroom community We recruit older adults from a community partner called Bloomingdale Aging in Place. And this was a happy accident of teaching. The first offering in 2018, there is an auditing program at Columbia. And we had like 8 older adults show up in our class as auditors. And we thought, oh my God, this is one of the things with to be nimble and flexible in your teaching. We thought, oh my God, this is great. We can integrate them into this community. We can actually walk the talk in terms of intergenerational connection. Okay, so this has some interesting assessments. We actually really want young folks to think about what they can do to lengthen their health span, right? What they individually can do, but then also what needs to be in place in society in order to enable that. So we have them write prescriptions for themselves and also for society in terms of how society would enable them to fill their personal prescription. And we have them go out to age 100, right? So for each decade of their life, they're connecting what we are, what their prescriptions are for themselves, rooted in the material that we've covered, and then saying, okay, here's what needs to happen in society in order for us to make that a reality. They do interviews with older adults in various spaces. We have a virtual reality component with 3 modules, one on macular degeneration, one on dementia, and one on the end of life. And that's really designed to foster empathy. And then finally, the kind of capstone project is a project that allows older adults and the younger folks in the class to come together to collaborate in groups to devise intergenerational solutions to climate change. It is one of the most pressing problems that we have in society. And this is this is kind of like the neighborhood tour project. We have, the last part of class that really focuses on this particular project. And what I'm going to do is my penultimate slide is a video that I want to share. It's about 2 minutes long. So you'll bear with me. This represents some of the extraordinary work that our students have done.
Getting up early and marching through the streets of Washington, D.C., chanting with Greta Thunberg and thousands of other people. It was incredible. Who wouldn't want to be a part of this crowd? Yet afterwards, when the protests ended, we all just went home and ate dinner. I thought to myself, there's got to be a better way to spend your protest time. So we created a local intergenerational green board in our hometown. It's the best way to get involved in your own community. Now, what is a green board? It is an accessible group of concerned residents wanting to tackle global climate issues on the local level, made up of young people and older people who have the energy, history, and experience to come together and affect change in their hometowns. Now let's head over to your local city hall. Your first step is to speak to this person, your village clerk. She will give you the date of the next town hall meeting and a time to speak during it. You should go prepared with your proposal of the intergenerational green board. At your town hall meeting, when it is your time to speak, you call for action to assemble people for the intergenerational green board and announce the meetings locally, calling for stakeholders in local newspaper or social media outlets. Once your intergenerational green board is approved, pick a date for the meeting. Prepare an agenda. Ask for ideas and input. Identify local challenges and targets. Call to organize. Plan for the next meeting. Build list of names, and ask for a board member to supervise or mentor. It might start small, but in no time, your meeting will look like this. And you'll be on your way to implementing yours and your neighbors' key actions for saving our planet. So, if you are here, We also need you to be here. We'll see you at the next March for recruitment. Go small and go home. Help your community first.
So that just gives you a sense, I think, of the extraordinary work that our students produce, how creative they are, how deeply engaged they are in the material, and what the possibilities are for the application of this material. So I'm going to end with this. Not surprisingly, I think, when you're scaling up, like, there are just real challenges, right? How do you maintain that connection? How do you bring in experts and also foster that community through an instructor-led experience? What do you prune? As we kind of grow and evolve, and as public health shifts and changes, what do you retain and what do you sideline? I think intellectually, that's an interesting question. Our virtual reality, which I didn't talk a lot about, but really is designed to foster empathy in our students. Clearly, we've had to kind of go online with that. We have those headsets that we used to have every single student like do these modules with. It's impossible when you've got 180 people to do that. And same kind of set of issues for managing resources. And so, look, I'm going to leave you with that. I really appreciate you giving me the opportunity to crystallize kind of my thinking around this, to reflect on what we've been doing in terms of an intentional approach to building a liberal arts and public health program at Columbia. So thank you so much.
Wonderful. I think we have about 10 minutes if anybody has any questions for Dana.
Sometimes in these big classes, thank you so much. This was really terrific and great to see kind of how it breaks down across the courses. In these big classes, sometimes you'll have labs, like students break out into smaller groups and do something else. Is that a model that you ever considered or tried along this pathway?
I would love to do that. It somehow seems resource impossible, but I'll tell you what I would absolutely do that if I were just given carte blanche and all the space and kind of time that I could. I would have one lecture, and I think you all do. You have this kind of model here, which honestly is enviable. I would do kind of a didactic session or flip the classroom, and then have the in time sessions kind of focused on application and engagement in small groups and so forth. Again, when you're talking about so many people, I mean, then you get into sections upon sections upon sections, and it requires staffing, it requires rooms, space is always at a premium. Maybe it isn't for you, it certainly is for us, I don't know. But it's something we have to contend with totally. And in many ways, during COVID, um, Zoom opened up interesting possibilities, I think, that for education and so forth, that we didn't necessarily have before. And for like in Introduction to Public Health, we use Zoom for like that final reflection session because it's only manageable through that particular mode. But if I had all the resources, the space, and the time, and the TA support to do that, I would absolutely do that. It just seems we're just in a tight set of constraints around this. Yeah. Yes. Hi. Tell me your name.
Yes, I'm Sarah Yu in the College of Arts and
Oh,
Sciences.
oh, excellent.
Yes, I think we have a conversation later. Thank you so much. This was wonderful.
Yeah.
So I really appreciated your kind of characterization of public health as in the deep purple.
Yeah.
I also really appreciate that your special program in public health is kind of integrated in the context of the liberal arts, which is absolutely in alignment, I think, with what we're trying to do here. So I'm curious, when you kind of give the agency to students to make their choice across those electives, are you seeing trends or patterns in their kind of curricular pathways and how they're making sense of what the deep purple means and what it means that public health is in the context of the liberal arts? If you could just speak to that a little bit.
Yeah, sure. So I'll take the electives piece. It really kind of depends on their majors, and sometimes it is an administrative issue. Like, they can double count STEM courses. And so folks who are pre-med are like, can I count general chem and bio, right? So there's that.
Yeah.
And unfortunate, but maybe not, right? Because they're focusing. It does tend to cluster around their major, although there certainly is a cross section of students who are like, listen, this issue was raised for me, in intro to public health, and what about this course? I do a lot of engagement in terms of approving electives and making recommendations about electives. And there's the major kind of alignment, and then there are the students who are in kind of another bucket who are just not, they might be a psychology major, but are like deeply interested in exploring racial divides and social the generation and maintenance of social inequities in health. So that's the general pattern that I can discern there. In terms of intellectual agency, I think people come to public health because they've got some interest in it. They've got some stake in it. It's personal for them in some ways. Maybe somebody has a family member who, has fallen victim to the opioid epidemic, right? There are all kinds of motivations for people to come to public health. So that I find that it's both intellectual for our students and it's deeply personal. And that's, I think this is also part of the connection piece, things that you learn in connecting with your students. In terms of the deep purple, I would not say that Columbia is the best place to say, like, I want to think and get our students to that place. I'll give you an instance. So I surveyed, we had a whole public health lecture that was focused on the election. And we do every year there's a major election. We address these issues and talk about what's at stake for public health and, what the various parties, it's usually a bipartisan conversation, what the parties' positions are and potential impact of their policies are on public health. Among the students, so I used Pull Everywhere to survey students, among the students who were eligible to and who voted, right? There were a bunch of students who didn't actually vote, right? We see that trend nationally. But about 20% of them voted for Trump, and their reasoning was economics. And I mean, it's all done anonymously, but there was about a similar kind of distribution of economics majors in the course. And it's the challenge I find is to be, we are a particularly progressive activist university, and I am acutely aware of being inclusive. And I think, we've thought about diversities. They're kind of major axes that we think about diversity. But increasingly, I am interested in really focusing on diversity of political affiliation, political belief, voting patterns, and so forth, because public health isn't just for progressives. Public health is for everyone. And I think, it's my job as an intellectual guide and a mentor to be inclusive in that engagement and be inclusive in that conversation. And so, some of the things I think that we could do, and we have done it in other fora, is have kind of point counterpoint, like a spectrum of views that are represented, and civilly and constructively talking about how we can cross belief systems and party lines to advance our mission of population health for all. So it's a challenge. And people have all kinds of feelings. It's a moment. But it is an opportunity, a real opportunity for us to be inclusive on a different level, I think.
Last question.
Okay, so many questions, but two related ones. One is, since you started this, I think in 2014, what surprised you the most about the evolution of the program? And two, what's changed the most in the student body that you identify?
Yeah. So what's changed the most, I think, is that the change has not necessarily happened programmatically. But I think there's been within course change and evolution, right? And so that's why I was saying that I think now's the time to reevaluate curricularly, synthetically, what this means and what our opportunities are. The students have honestly kind of become more radical over time, right? That view of kind of 11 years, a lot has changed in 11 years, right? And I think there is a consolidation of what people see as like a binary, like a moral binary in many ways, and that plays out, I think, in fears that are expressed, viewpoints that are expressed in class, and so I think that this has come. I mean, public health is in many ways a lightning rod, right, for this polarization. But I absolutely think that the progressive activist voices are way louder than the more conservative voices. And in fact, I think often folks who have more conservative viewpoints do not speak. And that's why I particularly at a place like Columbia. And so that's why I think it's so critical to have these various modes of engagement. I mean, I wasn't using like Turning Point or Whole Everywhere in 2014 in a class of 29, right? We were in a small room about half the size, like kind of sitting in a circle. Very, very different, right? So I would say the expression of views, the intensity of the expression of views has shifted over time. But I also think that another trend is that people are really starting to see public health in lots of different spaces. And so I think COVID-19 was a huge catalyst in that regard, a huge catalyst in that regard. So, we're
Silver lining.
yeah, no, absolutely, absolutely. So those are, I mean, broad kind of trends.
Thank you very much.
Yeah, of course.
All right, thank you so much.